Dr. Waters, this is Mike, and he lost a tooth playing five-a-side football. He's not happy about how he looks now that he has a gap, but perhaps more importantly, his wife is not happy with how he looks. We've discussed the various options: Maryland bridge, full bridge, partial denture and implant. If appropriate from a clinical perspective, Mike will prefer to have an implant. Mike has no other concerns with his mouth, teeth or gums. Thanks, Sarah. Is that a fair assessment, Mike?
Yeah, that seems about right. I mean, I need to get something done, otherwise my wife might knock another tooth out.
Well, I'm sure we'll get you smiling again soon. As Sarah's already explained, I'll be checking the inside of your mouth, your gums, your teeth, your tongue, and the insides of your cheeks. I'll be looking at your general dental health and looking for any signs of gum disease or any other health issues. I'll finally check your jaw alignment and movement. As I go through, I'll be calling out numbers and dental terms to my assistant Tracy. It might all sound like a foreign language, but I'll be happy to answer any questions you have afterwards. How does that sound?
Yeah, that sounds great.
Great, let's get started. Okay, Mike, we've had a good look at everything in your mouth, and in general, your teeth and gums are in good shape. There are a couple of areas that need a little more attention from you when you brush your teeth, and I'd like to refer you to our hygienist to get a really deep clean and some pointers on the best way for you to keep those hard to reach areas free from plaque. How does that sound?
Yeah, great. I'm glad to hear everything's okay, and I do try and take care of my teeth, but happy to see the hygienist.
Great, Sarah can get you booked in before you leave the practice today. With regards to the implant, I see no reason why we can't place one for you. Your bone is nice and healthy, your oral hygiene is good, and if you keep that up, along with regular visits to the hygienist, it should last you a really long time. Do you have any questions for me?
Yeah, how long will the implant take?
It's a fairly straightforward procedure, and one I've done many times. So we usually book you in for an hour to place the implant. We'll then have to let it heal for about 6 months, so initially you'll have a temporary tooth. Following that, we'll get you back in for another hour to fit the permanent tooth. So 2 appointments, 2 hours in total. How does that fit in?
Yeah, it's quicker than I thought. Will it be painful?
We do all our procedures using a local anaesthetic, and most patients are comfortable taking just a regular painkiller for the next 24 hours. Paracetamol or ibuprofen? How do you feel about that?
Yeah, I suppose I was wondering if I was going to have to take any time off work.
Well, what we can do is look at getting you booked in on a Friday. Then you've got the weekend to recover, and you should be ready to face the world again by Monday morning. How does that work?
Yeah, that's great. What's it going to cost me?
Well, as I said before, it's a fairly straightforward implant, a single tooth, which is £2,500. How does that fit in with what you were expecting?
Yeah, it's exactly what I was told in our initial phone call, so no surprise. Do I have to pay now?
Well, we always take a 20% deposit before booking the first appointment. The rest once we've placed the implant. Alternatively, we offer a finance option, which Sarah can go through with you after this. That way you can spread the cost. Would that help?
I'd certainly like to look at the options.
Okay, good. Then I'll hand you back to Sarah, who can go through the various payment options with you. She'll also be able to answer any other questions you may have, and then can look at getting you booked in for the first available Friday.
Great, look forward to getting it done.